Hello everyone and welcome back to my YouTube channel. If you're here for the first time, hi, my name is Bosari Moliayo and I am a registered nurse and a registered midwife. On this channel, I talk about nursing and healthcare. So if you're interested in content like that, you're a nursing student, you're an aspiring nurse, or you are a registered nurse and you want to come to revise topics about nursing, this is the right channel for you. So click on that subscribe button to join the YouTube family and also the bell icon so you get notified when I drop another amazing video. With that being said, let's get into today's topic. So I am assuming that you clicked on this video because you are about to start your clinical posting as a nursing student and you don't exactly know what to expect. You've heard a lot of things, you've seen a lot of things on social media. You're wondering if people are going to be nice to you, what do you expect from the patients, your peers. You don't really know what is going on, especially if you're the type of person that you don't even have any healthcare experience and you have never worked in the hospital at any point in time, or you have never been to the hospital, you never had to visit somebody, or you just don't understand how the hospital works. In this video, I'm going to be dropping tips on how you can get through your clinical postings well and what you should expect from the clinical posting. Your first expectation as a nursing student when you're going to clinical posting is that number one, you're going to be seeing a lot of patients and you're also going to be meeting a lot of other healthcare professionals who are not nurses. So once you've been told the first word you're going for your clinical posting or your clinical placement, let's say for example you've been told that your first posting or your first rotation is on orthopedics wards, the first thing you need to go is to go and research about the ward. What type of patients are you expecting to see on those wards? What type of conditions are you expecting to see on those wards? And possible nursing procedures that you would be seeing and possible medical procedures that you would also be seeing on those units. Is going to help you prepare for your first day on that unit. So research about that ward. Another thing you should research about are the various healthcare professionals that work in a hospital, so that when you see people and they introduce themselves to you, you will not be confused as to what their role is and how you're supposed to relate with them. You are not only going to be meeting nurses on the ward, you're going to be meeting physiotherapists, you meet doctors, you meet pharmacists, you meet med lab scientists, you meet a lot of other healthcare professionals within the hospital coming in and out. And you might want to also go to the hospital and just have a walk around to know where things are, even though that might be a lot. Eventually you used to get used to it, but if you want to do that, it's advisable. So those are the first two things you should research before you go to the ward. The next thing I'm going to be talking about is punctuality. One major issue about punctuality is because one, it gives you a good first impression. If you come to the ward late, maybe in the middle of handing over or after handing over, it gives a very bad impression that probably you're not serious or you're not even interested in whatever is going on in the ward. So punctuality is something you should consider. And because you would be doing handing over of the patients before the start of the day, it is important for you to be punctual, because it is during the handing over that you get to know the names of the patients, their conditions. Like you can even hear some new medical terms, and you might also be able to ask questions from the nurses during handover or after handover. Like handing over gives you a very good preparation for the day, and you should not miss that, because if you miss handover, there's a very high chance that you're going to be confused. And if you also miss handover, you may miss allocation, duty allocation or preceptor allocation, which like probably they'll allocate you to a nurse to oversee what you're going to be doing that day, or they've allocated you and some of your colleagues to work on the patients, and when you come late they just say, okay, just join these people, and you don't really know what's going on. So punctuality is actually very, very important. Next thing you should know is that you have to observe. You have to observe a lot, especially if it is your first time. You may not be allowed to do a lot of things. It's not because you're not competent, it's not because you're not intelligent, but nursing, when the things that you handle as a nurse are very, very should I say delicate things. You're handling lives. Tiny mistakes may cost a life. Tiny mistake might cost a lot of things. So do not be surprised if the nurses do not allow you handle a lot of things on your first day. And I have had to work with student nurses, and if I work with you as a student nurse and I've never worked with you before, I would actually want you to like observe me first, at least for the first 1 or 2 hours during the shifts. I want to see how serious you are. I want to see how willing you are to participate before I can delegate you to do some things. I need to be sure that, okay, I can actually trust the student nurse to do some things. If not, I too will not want to hand over things to you, because I'm the child nurse. or I'm the registered nurse you're working with, and it's my license on the line if you make any mistake. Because you might find some situation where you say, oh, some nurses don't like us to do anything. It's because they don't trust you, and you can't exactly blame them. They are meeting you for the first time. They don't really know how much you're willing or how much you're interested. So you should learn to observe first. Don't just sit down when the nurses are doing procedures. Fine, some of them will say, oh, why are you following me around? Just show willingness to know what is going on. Don't just sit down and when they are doing procedures, you just say, oh, so because the nurse did not call me to help, or because the nurse did not call me to come and assist her, I won't do anything. Show interest, be willing to be there and observe. Another thing I'm going to talking about is go with a notebook. You're going to be hearing and seeing a lot of new things, and trust me, you cannot remember everything when you get back home. You will not remember everything when you get back home. It's not possible. So going with a notebook to write down every new word you hear, and you may not have the opportunity to even ask all the nurses every new word you hear, and some of the things you hear, they may not even be able to supply you adequate answers immediately. So writing them down gives you an opportunity to go back home and review all those things and improve your knowledge about the hospital and patient care as well. Another thing I'm going to be talking about is your personal safety. Look, no matter the word you are being posted to, you have to put your safety first. You have to put your safety, because because the fact that you're a new nursing student, you may not really know a lot about infectious diseases that are going on in that world. Like, you're probably your first year or your second year, and that's like your first experience in the hospital. You may have read about infectious diseases, but the fact that you have not really seen how bad it is and how serious it can be when someone gets down with all those kind of conditions, you may not really be able to appreciate or understand that. But take your safety very serious. Wash your hands at every point. Don't touch anything with your bare hands. Please do not touch any patient with your bare hands. Do not touch anything. If you're not allowed to touch it, leave it alone. Leave it alone. Do not just go to any drug, go and check any ampoule without permission. Always ask your safety first, because you could be entering a place that is hazardous and you don't even know, like you have no idea, and it could cost you so many things, including your life. So you don't want to be caught in a place. You don't want to go into a place where you can contact any infection, or you've gone to the patient's bedside and you're leaving and you did not wash your hands, and you go and eat and you take all those microorganisms into your body and you come down with so many things. No, your safety is very, very important. Ensure you always wash your hands and you don't do things that you are not told to do. Next thing I'm going to talk about is don't let anybody bully you. Do not let anybody bully you. Nobody's supposed to send you on errands. Don't let anybody bully you. That's all I'm going to say. If you're willing to be respectful as an individual, it is different. If you're willing to be to be cultural as a person, it is different. But at any point in time where you feel that you are being bullied, being harassed, being abused, please report. Please report. Do not let anybody bully or abuse you, or just talk to you anyhow because you're there for clinical person. You're there to learn. You're not anybody's slave. You're not anybody's errands girl or house girl. Please. Another thing I'm going to be talking about is follow rules. Follow healthcare rules. I'm not saying follow cultural regulations. I'm saying follow nursing ethics. If you're not supposed to wear certain types of outfits, you're not supposed to do certain types of hair, wear certain type of nails because you are on the clinical area or you're in the clinical area, please don't save yourself the stress of being punished or giving yourself a bad image in the presence of your nurses. Don't save yourself the stress. You won't gain anything from being tagged the black sheep, or being tagged the notorious student, or being tagged the stubborn student. You won't gain anything from it. So don't bother. Like, just follow rules and give yourself peace. It's just for those couple of hours that you're going to be on the clinical posting. Once you step out of that place, you're off the uniform, you can wear whatever you want to wear, you can do whatever hair you want to do, you can fix nails as long as the road, nobody cares. But once you're in that place, please follow it, because most of the time the rules are not there to bully you or to make you less beautiful, except when they are extreme. That was when I said follow nursing ethics. I'm not saying follow cultural regulations. The rules are not there to bully you. The rules are not there to make you less beautiful. The rules are not there to make you less of a person. It is for your own good. it is for your own good, and you may not fully understand, you may not fully appreciate the rationale behind a lot of those regulations because you're still new in the system. It's your first time, or this is your second time coming to the clinical wards. You've not had a lot of experience and see things that can actually go wrong and reasons why those regulations were actually put in place. So please save yourself the stress and follow rules. I wish you all the best in your first clinical posting. Follow my channel for more nursing videos, and I'll see you in the next one. Bye.